Many of my nephews and nieces ask me how to become a plastic surgeon. I can only tell you about how to become a plastic surgeon in India, because I have become a plastic surgeon in India going through the medical education system in India. So let me give a brief overview of that. Things might have changed recently, but the general format is pretty much the same. Now, if you have had an inspiring plastic surgeon that you look up to and you want to become a plastic surgeon like that, I think right now you need to develop an interest in biology in general. So biology can have many things, but interest in biology is an absolute must before you think about pursuing anything in the field of medicine. So even in your high schools and your 11th and 12th, you need to be very passionate about biology. So once you finish your 12th, there are options of giving something called as a NEET exam right now. So in that NEET exam, it's like a medical entry exam. So it's almost a pan-India exam, barring a few states in India. All other states except NEET as the preliminary examination. So once you give that exam, it's a competitive exam, MCQ based exam. If you pass through that, you get into medicine. When I say medicine, you get into the course MBBS, that is Bachelor of Medicine and Bachelor of Surgery. This is currently a 5.5-year course. So you learn a lot of subjects during that 5.5 period. The first 4.5 years are mainly classroom based teaching with a little bit of exposure to the hospital, and the last year is going to be something called as an internship, where you are actively working in the hospital to gain hands-on and practical experience. So once you finish your MBBS, then you need to look into getting to the next postgraduate level. So MBBS is graduation, and after that you go into post-graduations. Now, if you're so focused into plastic surgery, you can actually get into a direct 6-year plastic surgery course too, just after your MBBS. There are many institutes in India offering something called as a DNB plastic surgery 6-year course. You can look in the Google which are all those institutes. For that, you need to give a DNB exam. So DNB entry is also a NEET exam now. So NEET organizes this DNB exam. So in the NEET exam, post-graduation, there will be broad specialities and super specialities. So you can opt for a direct 6-year course in plastic surgery for super speciality if you're very focused. But if you want to take it easy, you have plastic surgery at the back of your mind, but you want to see how other surgical specialities are, then probably it's a good idea for you to go to the broad specialities. That is, take a MS in general surgery or a DNB in general surgery first. So while you're working to finish your DNB in general surgery or MS in general surgery, you will get exposure to all fields of surgery: cardiothoracic surgery, urology, gastric surgery, then plastic surgery, neurosurgery, pediatric surgery. So there are many aspects of surgery where you will get exposed to, and that time maybe you will make a even better decision of, okay, yes, now I really want plastic surgery. So once you finish your broad specialty, that is MS or DNB in general surgery, then you have to give your again a NEET super specialty exam, where eventually you can choose something called as a plastic surgery. Once you take up the plastic surgery course, that's again a 3-year course. So in total it is a 5.5 plus 3 plus 3. So totally 11.5 years of studying, come working in a hospital setup to finally become a postgraduate pass out in plastic surgery. But this is usually not enough. Most of the plastic surgeons then undergo some training, a little bit further training, some fellowships abroad, some fellowships in specific areas, also called as ultra-specialization now. For example, my special interest is craniosynostosis. So I have done a craniofacial surgery fellowship in Australia. So once you finish that, then ultimately you can actually start practicing on your own or work in a hospital, which might take about 12 to 14 years after your 12th to get into that phase.